At University of Virginia Health System, we're for sharing the latest health information from top minds to keep you and your family healthy. With UVA Health System Radio, here's Melanie Cole.
Between 60 and 80% of people will experience low back pain at some point in their lives. Sometimes called a slipped or ruptured disc, a herniated disc most often occurs in your lower back, and it's one of the most common causes of low back pain. My guest today is Dr. Hamid Hassanzadeh. He's a fellowship-trained spine surgeon whose specialties include minimally invasive spine surgery, complex spinal deformities, and herniated discs at UVA Health System. Welcome to the show, Dr. Hassanzadeh. Tell us, what is a herniated disc? People hear this term and they're not even sure what that means.
Good morning. Thanks for having me. So our discs are built up out of two portions, the outer portion and the inner portion. When we get older, the outer portion ages a little bit faster. What happens, you get small tears into the outer portion, and part of the inner portion could come into the canal and pinch our nerve. That creates usually back pain and leg pain and so on.
So when the spine and the discs, how are they designed, and are they supposed to be moving around like that?
Absolutely. So they're a cushion for our and part of the mobility of our spine. We're able to move our back and neck because of the joints, and part of them because of the discs. Discs are taking the pressure when we jump and when we sit, and that's why they're more prone to injuries and more prone to herniation or rupture. And that's why they're one of the first things that cause a back problem when we get older.
So let's talk about what causes it first, then we'll get into some symptoms. What are some causes? How does somebody herniate a disc?
One of the biggest part is genetic. Like everything else, our genes basically predispose us to a better quality or lesser quality of disc. People have a family history of disc herniation, disc problem. They tend to have more problem when they become older than those patients who do not have a family history. The other activities are bending forward, increase the pressure. If people try to lift something, it's a very common scenario that someone said, I tried to lift a heavy box, and I felt a sharp pain in my back. It's a very common scenario. What happens when we bend forward is the highest pressure in the disc, and we add some weight into that increase the pressure in the disc and create tear and create the herniation. So activity and genetics, and some of them are overused, could cause this disc disease.
Is a herniated disc the same as a bulging disc?
Not quite. A herniated disc means where a portion of the disc came into the canal and impinged some part of a nerve. Basically, herniation means part of the disc really tears outside the disc and comes into the canal. A bulging disc could be absolutely normal. When we get older, we lose some of the fluid and some of the height of our disc, and the disc doesn't look quite juicy, and it looks a little bit like a flat tire. And that's appearance of flat tire called a bulging disc. Could be absolutely asymptomatic, and a lot of people have it without knowing.
So what are some symptoms that people experience? Because people have low back pain from a myriad of reasons. Their mattress, or as you say, they just reach something wrong or lift something improperly. What are some symptoms that this is actually an issue?
So back pain per se is a multifactorial problem. So it could be a structural, or a bony structure, or it could be a disc or muscle, or all combined could cause back pain. A disc herniation is a very typical, especially in the lumbar spine. A disc herniation can also go to your neck and a thoracic spine. But the lumbar disc herniation, which is most common, as you said initially, most common problem and most common area that occurs. The lumbar disc herniation, the typical story is that they did something and it felt a sharp pain initially, and then the pain migrates or radiates down the lower extremity. That's a very common description of a disc herniation symptom.
So if someone has that pain going down their leg and they say, oh, I've got sciatica, then what do you do for them? Give us up some of your first lines of defense, Dr. Hassanzadeh, with some non-surgical treatments, things you can try at the beginning, and then we'll see if it needs to have surgery.
Absolutely. The majority of people who have a disc herniation will not need surgery. So what happens with this, our body has some healing potential. Well, we absorb the herniated disc and makes it better. The time usually plays a role into that. But we could help the symptomatic treatment, which could include injection. Steroid injection will decrease the inflammation around the nerves and alleviate the pain significantly. We tend to go after injection once the pain is better controlled. We tend to send the patient for physical therapy to increase the core muscles. It's a very important component of the entire stability of spine and will prevent further damage or further degeneration of the disc. So usually if someone comes to me with the acute disc herniation, then the path we send the patient before we get even advanced imaging, we don't have any neurological deficit. We send them for an injection, epidural steroid injection, followed by physical therapy. And we wait to see how they do. If the patient is resistant to non-operative management, which includes at least minimum of 6 weeks of non-operative management, sometimes even up to 3 months, then a surgical indication were given. But like I said, the majority of patients will do well without surgery.
How often are you willing to give an epidural steroid injection? Some people want to come in for them every couple of months or every 6 months. How often can somebody get one of those before it's enough?
So in my practice, I do not like to have more than 3 injections, epidural steroid injections per year. So if it's if 3 injections that fail to improve the symptoms, then we have to change our management plan or management strategies.
Now let's talk about prevention. Is there a way to prevent herniated discs and general back problems? What do you tell people, Dr. Hassanzadeh?
So a strong core muscle could prevent a lot of back issues. If the muscles are very strong, the core muscle includes the abdominal muscles, the back muscles, the thigh muscles, the chest muscles. They're all part of the core muscle. A very strong core muscle could prevent disc herniation, disc degeneration, and all other type of cause of back pain. So my biggest recommendation to prevent back pain and disc disease is to keep the core muscle strong and stay active.
So doing regular bits of exercise, and you mentioned at the beginning, in just the last few minutes here, you mentioned at the beginning some movements that people do. So learning proper lifting techniques, because in my practice, Dr. Hassanzadeh, I've seen people lift a weight and then they turn to set it down somewhere. And right then and there, you can see the pain. What do you tell people about these proper lifting techniques so that they don't do that sort of thing?
Absolutely. So this is the exact scenario you described, a very common scenario you described. Lifting and turning around creates an increased pressure and a shear force, which is a bad combination which could cause a tear in the outer portion. So usually I try to tell my patient to not lift from a bending position. Try to go kneel and lift a heavy object. And twisting usually with bending position is not a great exercise for back. It could create inflammation, it could create tears, and so on. I think overall, if they work on their core muscles, stay active, and do some activity modification, which also include a prolonged sitting, by the way. Because when we sit down, this is the time where the pressure is the highest now at disc. So avoiding prolonged sitting, changing position, standing for a few minutes, and doing some general modification will really prevent a lot of trouble for our back.
And why should patients come to UVA Spine Center for their care?
So we have a phenomenal team of a multi-disciplinary approach. We have a great pain management system, a great interventional system where patient could receive their injection. We have a broad spectrum of experts, including the spine surgeon and a neurologist and interventionalists that could help the patient to get everything in one place in a world-class.
Thank you so much for being with us today. You're listening to UVA Health Systems Radio. For more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening.